everyone. So in the last video we treated glucose 6-phosphate dehydrogenase deficiency, and today we're going to be treating a whole different topic. We're going to be looking at different approaches to therapy in patients and the best way to select antibiotics. We are going to be looking at goal of therapy. We're going to be looking at why we give certain medications for certain conditions and how we come about this selection of these particular medications. So this particular topic is very useful to different health professionals, and I think it will be very necessary when prescribing medications for patients, and basically in general just how we can just break down the symptoms the patient is having, how we can listen for better understanding. So that's what this topic is all about. So looking at approach to therapy in patients, when approaching therapy for bacterial infections especially, it is important to follow a structured process that ensures the best treatment outcome and also minimizes resistance, because there's a lot of antibiotic resistance lately. So minimizing resistance, toxicity, and also minimizing the unnecessary use of antibiotics, because sometimes someone could just be having a simple condition that you could just give them a cough medication and then you would be adding antibiotics when it's not needed. So unnecessary use of these antibiotics, we're going to be looking at how we can minimize all these effects. So looking at general approach to therapy in patients, we're going to do a stepwise approach. So for step 1, first we identify the source and the severity of the infection. So we determine if the infection is mild, if it's moderate, or if it's very severe. And like we could do this by asking the patients like how they feel, like when the symptoms started, and the intensity. So we have to know if the infection is mild, if it's moderate, if it's very severe. Then we have to identify the site of infection. So you would ask questions like, where are you experiencing this? If it's itching, like which part of your body are you experiencing this itching? How often does it happen? Is it spread to different locations, or is it just localized in one section? So you identify the site of the infection. If it is systemic, spread throughout the body. If it's just affecting one particular part of the body, then assess the symptoms and the systemic involvement. So assess if the patient is having fever, if the patient is having any organ dysfunction. So that is for step 1. Step 1, we identify the source, the severity of the source and the severity of the infection. Then for step 2, we collect relevant samples for diagnosis. So for example, if the patient has gone for a laboratory test, so we collect this laboratory test, and even if they've not done laboratory test, if it's necessary, we send them for a test, and then we collect these samples, and then we identify what is not normal with the figures in these samples. So you collect the relevant samples for the diagnosis. Then the third step, you start empirical therapy. So this empirical therapy is basically the therapy you do before you get the lab results. So most of the time empirical therapy is done with broad spectrum antibiotics because they are not limited and they can cover a variety of infections. So we mostly do empirical therapy with broad spectrum antibiotics, and is based on the suspected organism and the site of infection. Then you also consider, when you are giving this empirical therapy, you also consider local antibiotic resistance patterns. So you put it into consideration. Then if the infection is severe, you start treatment immediately after taking the samples. Then for step 4 is narrow therapy based on when you've gotten the test results. So when you've gotten the test results, you've understood what is occurring in the patient, then you switch to the narrow spectrum antibiotic that specifically targets the patient's condition and identify the identified bacteria causing the problem. So you also avoid unnecessary prolonged use of broad spectrum antibiotics due to reduce antibiotic resistance. Then for step 5, you monitor the patient's response and adjust the therapy if needed. So you check if the symptoms improve by you collect the patient's number, give them a call whenever you're free to just update let them update you on how they are feeling, if their symptoms have improved or if the symptoms are still, or even if they haven't getting worse. So you check for if the symptoms have improved and if they are taking their antibiotics as prescribed, because there are a lot of people that you give them antibiotics, let's say ciprofloxacin for example. Now they will take it for just the first day, they take it morning and night, and then when they start having this small relief, this something once they start feeling a little bit better, they just throw it to one side. I'm feeling okay already, why do I need to continue this thing? Why do I need to keep taking it? Remembering to take this antibiotic is stressful for me. So there are some people like that. So you have to keep your patients in in touch. You have to know if they are still taking the antibiotics after you prescribe them, because it's due to incomplete dosing and lack of patient's adherence to finishing their complete dose that causes antibiotic resistance most of the time. So basically those are the stepwise approach to therapy for patients. So now we're going to be looking at the best way to select antibiotics. Before I move on to the best ways we can select antibiotics, so also in that step 5, if you are regularly checking on the patient and then you notice that the patient keeps telling you there's no improvement, that nothing is even getting better with the antibiotics that you're giving the patient, it just basically means that either the antibiotic is not strong enough for the condition, or the patient has developed a resistance to this antibiotic. So most of the time you have to change these antibiotics, change it completely from don't give, for example, if somebody is on levofloxacin now, do not give the person, if somebody is on ciprofloxacin now, do not give the person levofloxacin, because they are both in the same class. It will be ineffective. But it's better if you switch to another class like azithromycin. So that is basically what you do in this case when there's no improvement and patient is still complaining about the same symptoms. So you reassess the diagnosis, you look at the results again. What exactly are you missing out? You look at the results, you might tell them to repeat the test. So after all that, then you can consider changing the antibiotics. So when we're looking at the best way to select antibiotics, so selecting the most appropriate antibiotics, it depends on 2 key factors. So the first, sensitivity testing. So we're going to look at sensitivity and site. So sensitivity testing, this is basically determining which antibiotic will work. So there's something called antibiotic susceptibility testing, AST. So it is done in the microbiology lab using methods like Dick's diffusion test, which measures the bacterial resistance to antibiotics. Then there's also something called minimum inhibitory concentration, which determines the lowest antibiotic concentration that prevents bacterial growth. So the bacteria, they are classified as sensitive S, which is the antibiotic that is effective. Then there's intermediate I, which is the antibiotic that may work but at high doses. Then there's resistance R, that is the antibiotic that is not effective. So usually you see this in a lab test results. You would see let's say a particular bacterial infection is suspected in an individual. So they would list out all the possible antibiotics that can be given. Then you would see them right beside it, like resistance. Then they would write, it's usually explained, so they would write R. R means the antibiotic is not effective because there is high resistance. Then they would put this plus plus sign. So usually when there's one plus, it's usually means second line for this particular infection. Then when there's double plus, it means it's first line for this particular infection. So that is how it usually comes. So that is for the sensitivity test. So when we are looking at the site of infection, so usually the antibiotic penetration matters. So some antibiotics, they work better in certain body sites due to their ability to penetrate the tissue and fluids. So examples of site-specific antibiotic selection, like we have meningitis that attacks the central nervous system. So we choose antibiotics that can cross the blood-brain barrier, like ceftriaxone, meropenem, or vancomycin. Then for urinary tract infection, we use antibiotics that can concentrate in the urine, like nitrofurantoin, ciprofloxacin. So these antibiotics that can be highly concentrated in the urine. Then for lung infections like pneumonia, we use antibiotics with good lung penetration, like azithromycin, levofloxacin, ceftriaxone. Then for bone infections like osteomyelitis, we use antibiotics that penetrate well into the bone tissue, like for example clindamycin. So this is about finding the best antibiotics that would work for a particular infection. So now looking at goals of therapy. So when the overall goal of therapy in bacterial infections is to eliminate the infection, prevent complications, and ensure symptomatic relief. And this can be broken down into different parts. So first we have the symptomatic relief. So we basically break it down into symptomatic relief, the real treatment, and the prognosis. So for the symptomatic relief, we are basically managing the symptoms while the antibiotics work. So for example, for fever control, now we could use paracetamol or ibuprofen to support these antibiotics that we're giving. Then pain management, so if the patient has pain, we use analgesics based on their history. If they have ulcer, we can't give NSAIDs. And we also do symptomatic relief like fluids. And if they have ulcer, we can't give certain NSAIDs, not all NSAIDs. We can give celecoxib. So if they have also for symptomatic relief, fluids and hydration too are very important, like supporting them with intravenous fluids if needed, especially in cases of sepsis, which is a very serious condition. Then in terms of when a patient has respiratory distress, like oxygen therapy or oxygen support. So looking at that, so first we handle the symptomatic relief, then we now look at the real treatment. So the real treatment basically means eliminating the infection, making sure that the infection is eradicated from the body. So we choose an appropriate antibiotic based on susceptibility testing and site of infection. So we use monotherapy or combination therapy depending on the severity and type of bacteria. So monotherapy means just giving one antibiotic, then combination therapy means giving more than one antibiotic, usually from different class, depending on how severe the bacterial infection is. Most of the time when we use combination therapy is for cases of very severe bacterial infection, because most of the time monotherapy is usually enough for mild bacterial infections. So example of treatments like sepsis now is an example of a severe bacterial infection, and we usually treat it using empirical broad spectrum antibiotics like a combination of meropenem and vancomycin. Then for pneumonia, a combination of ceftriaxone and azithromycin, especially for community acquired pneumonia. Then for urinary tract infection, we could give monotherapy of ciprofloxacin or nitrofurantoin. Then skin infections, most of the time skin infections work, we could give flucloxacillin for staphylococcus aureus infections. So like I said, we look at the symptomatic relief, the real treatment, then we look at the prognosis. So prognosis is basically the expected outcome of therapy. So for mild infections like uncomplicated urinary tract infections or mild pneumonia, they have an excellent prognosis with proper antibiotic therapy. So we often expect a good outcome when the antibiotic dosing is completed. Then for severe infections like sepsis, meningitis, they usually require aggressive treatment and may have high mortality if not managed properly. Then for multi-drug resistant infections, they may require prolonged hospital stays and specialized antibiotics like carbapenems. So basically the prognosis is what we expect from after we give this therapy, and how we can prevent this the condition from reoccurring. Basically how we can prevent the condition from reoccurring in the patient. So basically we're going to look at goals of therapy, like for general, how do I put this, for general goals of therapy in terms of other conditions, not just looking at antibiotics now, so not just looking at bacterial infections now. So we're going to look at the general goal of therapy in terms of other conditions that could affect a patient. General goal of therapy, like I said, for bacterial infections, symptomatic relief, real treatments, and prognosis. So it's the same for general, for other conditions. So the first step in therapy is to manage the distressing symptoms while addressing the underlying cause. So for example now, for pain relief, we could use analgesics, paracetamol or ibuprofen. Then fever control, antipyretics like acetaminophen. Cough suppressions, cough syrups, dextromethorphan. Then nausea control like ondansetron or other antiemetics. Then for the real treatment is the curative or disease specific therapy. So this therapy directly targets the underlying cause of the disease. So bacterial infections, we use antibiotics. This is the real treatment, like using amoxicillin for streptococcal throat infections. Then for diabetes, using insulin or oral hypoglycemic agents like metformin. Hypertension, using antihypertensive drugs like ramipril, hydrochlorothiazide. Viral infections, using antiviral drugs like acyclovir for viral infections. So also for the prognosis and preventive care, So the expected outcome of the treatment and the strategies to prevent reoccurrence is basically what this prognosis is about. So the so basically how to prevent the reoccurrence of infections is just by completing the full antibiotic course to prevent resistance. Then for chronic diseases like long-term lifestyle changes and medication adherence, then vaccination is a preventive care preventing future infections like pneumonia or influenza. The regular monitoring, like for hypertensive patients that are on antihypertensives, so regular checking of their blood pressure and also checking of fasting blood sugar for diabetic patients. So in conclusion, a structured patient-centered approach to therapy improves outcome, and it usually reduces medication errors and enhances overall healthcare quality. So both doctors and pharmacists, they must work together to ensure that the patients receive the most effective and appropriate treatment. So the key takeaways here is that always assess the patient's history and condition before starting any therapy. Select the treatment based on the patient specific and disease specific factors. Then use evidence-based guidelines for drug selection. Then monitor the therapy for efficacy and safety. Then educate the patient on their treatment plan for better adherence. And lastly, adjust the treatment based on how the patient responds to the treatment and new clinical findings. So that is basically the breakdown of the best ways to approach therapy in patients and the best ways to select antibiotics and the best ways to approach goal of therapy. So thank you.